Let me tell you one thing, it is so much fun making these videos about operations. I've really enjoyed doing it. I hope to continue to do it. Now, as I said here, I also mentioned this in another video when I teach about surgeries. I want to talk more about surgeries that are not commonly done, not well known to all, that are not often mentioned. Because my clinical practice is already like that. I don't prefer to do frequently performed surgeries. For instance, I don't do rhinoplastic surgery. I stopped for about 4.5 years. I have nothing to do with rhinoplasty. Other than that, what else? I like to perform a variety of surgeries. Like what? What I'd like to talk about today is tongue reduction. Well, sometimes a patient's tongue is too large. How does that happen? It's congenital from birth. The patient is a child and the tongue is outside the mouth. There are patients who come and bite their tongues. They bite their tongue while speaking because the tongue is hanging out all the time. It doesn't fit in the mouth. This sometimes happens in adult patients as well. It can sometimes be result of a disease. A substance accumulates on the tongue and so on. It bloats and grows. Now we perform tongue reduction surgery on such patients. But for some reason, this is something that is not so well known. Even if they know, they hesitate. For instance, there were 2 patients who came to us, children. They were examined beforehand and discussed before the hospital committees. Then the operation was cancelled and they were discharged without having been operated on. These patients come to us and we perform these surgeries. This surgery has a standard technique. There are so many methods of tongue reduction that have been published in books throughout history. I have put a graphic presentation of them on my website. We also use one of these techniques mentioned in these books. There's a simple pattern drawing on the tongue. Here what is drawing means. Whatever the patient needs, you must modify it accordingly. Let's say the patient has a big tongue, but it's also thick, bulky. Thickness is also important. Now, while reducing the mass of the tongue, we have to plan in such a way that we reduce the size in terms of width, length, thickness at the same time. There's the thing, each plan is specific to the patient. That being said, I think the problem with these child patients was this. I think the reason they were before the hospital committee and then dismissed with the cancellation of the operation was this. There's a fear that after the operation the tongue will swell, become edemacious and interfere with the patient's breathing. Here we have 5-year-old, 4-year-old patients that we have operated on. We perform these surgeries and they are hospitalized overnight. The necessity of being supplied with liquid food next day. Sometimes the patient will not eat at all because of the sutures on the tongue. We usually give them soup the next day. We try to give them liquid food, but it may be that a child cannot eat all because of the pain. That's possible. They stay at the hospital the next day too. One more night. They eat the next day and then they are discharged. I cannot recall any patient of mine staying in a hospital for more than 2 days. Other than that, there's a major swelling on the tongue or any blockages. In these patients, the stitch material on the tongue is self-fusing suture material. It does not need to be removed. It falls off by itself after a week or 10 days. The patient doesn't even notice. I videotape the patients talking before and after the surgery. When they speak, like I said, they usually have their tongue sticking out by biting their tongue because the tongue doesn't fit them out. We do another video 3 days after surgery when they come in for follow-up. They usually speak normally. If the child is not so small, he or she speaks. Like I said, actually there's nothing troubling when it comes to children. People assume that would be a problem, but that's not the case. There was a complaint with a couple of the cases I have had with adult patients. These patients were stuttering. They had a kind of speech disorder. They were going to speech therapy. At speech therapy, they give an exercise like they place a pen under your tongue and you are supposed to hold the pen using your tongue. It is said that in these cases, the tongue expands after performing these exercises. Indeed, the tongues of the patients that came to me were really enlarged, and the patient was biting the tongue with his back teeth. There's no problem on the neck, but every time he speaks, he bites it with his back teeth. It's got quite large. In these patients, we perform a tongue nerving surgery. We modify pattern and drawing I mentioned accordingly, and we plan to narrow the tongue even further.
Bu hastalar da çok rahatlıyor.
The width of the tongue is no longer obstacle to speak. If it is too wide, it hinders speech because he is constantly biting it.
Konuşmasını bozuyor.
But if we make it narrower, the tongue will no longer be bitten.
Kurtulmuş oluyor değil.
It becomes narrower and speaking becomes much better. In short, it's a kind of surgery, very high degree of satisfaction. We just have to change the drawing to fit the patient. There are few patterns. The one I'm using is one of them. You can find these drawings on my website is cosmeticcerrahi.com. It's not quite finished yet, but when it is, it will also be on otb.com. It is a hassle-free surgery with almost no bleeding and you will get good results. I also want to let you in on a trick to this surgery. There's a nerve under the tongue that gives you the tongue movement. It comes right under the tongue. You shouldn't get too close to that nerve, but again, a surgeon who applies the drawing and knows the anatomy well will not go there. So there is such a risk. But only if very ignorant, uninformed surgeon is doing the surgery. Can I make myself clear? Usually it's very difficult to get down there. The plant drawing is very far from the nerve under the tongue. You have to know that. But we can say it's a potential risk factor. There's nothing else about it, that's all.